Hello everyone, welcome to my channel, and today the topic of discussion is ulcerative colitis, a condition which affects millions of people worldwide and which has a long lasting symptomatology. So we'll go through the complete pathology of ulcerative colitis, and then how do we proceed the treatment, and then specifically I'm going to talk about certain medicines in homeopathy which really work excellently in these cases and can improve the quality of life of patients suffering with ulcerative colitis. So to begin with, let's try to define what is ulcerative colitis. Okay. So this is a form of colitis. Colitis means inflammation of colon, which is large intestine. Now, it presents with ulcers or open sores in colon, and patient comes with constant episodes of diarrhea mixed with blood and or mucus. And this is actually an intermittent kind of disease. What does it mean? That means the patient will have two phases of disease. Sometimes they will have period of exacerbation, where this is a stage in which usually they come to us in our clinical practice. And sometimes there will be a stage where they will be symptom free. They will have no such symptom. But again, this can go back into symptom stage. Now, it's very common to see ulcerative colitis in two age groups. The first age group is 15 to 25 years of age, young adults, and patients over 60 years of age, so elderly group. If we try to understand what are the causes, in majority of the cases, the cause remains unknown, but certain studies have shown that there is generally a genetic predisposition. So sometimes we can see a familial pattern. Of course, diet here is very important because that triggers the onset of symptom. People with low fiber diet, which is very, very common to witness in today's times, where the lifestyle and the type of dietary intake that we see amongst patients, low fiber diet is definitely something causing ulcerative colitis. And then again, autoimmune disorders. Now, when we try to see the clinical features, the signs and symptoms the patient comes with, it actually depends on the extent of the pathology. So patient can come with diarrhea, episodes of diarrhea mixed with blood and or mucus. So there can be variety of patterns. Generally, this is of a gradual onset. Patient can have weight loss. Patient can come with abdominal pain, which again can vary from a very mild kind of pain to severe cramps. And on rectal examination, we can see blood. Now, since this is a systemic illness, meaning that it affects multiple areas in our body, ulcerative colitis often has extra-intestinal symptoms. So we will notice that patients can also come with associated skin symptoms. Patient can have joints affected, so they can come with painful knees or variety of arthritis. Patient can have DVT, deep vein thrombosis. Patient can come with mouth ulcers, aphthous ulceration. Patient can come with clubbing. Patient can have eye symptoms, iritis, uveitis, episcleritis. Patients can have ankylosing spondylitis or sacroiliitis. If you wish to see, one of my episode is completely describing what is ankylosing spondylitis. You can go and check that video. Now coming to the pathology of ulcerative colitis. Again, depending on the extent of the ulceration throughout the colon, if we see that only rectum is involved, we put that case into proctitis. If we see that the area involved is the rectosigmoid part of colon, then that is called as proctosigmoiditis. And if we see that the splenic flexure is involved and also the descending part of the colon is involved, usually which is on the left side of our abdominal cavity, then it is called as left-sided colitis. So these are the distal colitis categories. But of course, there are cases where the entire colon is involved, then that is called as pancolitis. Right. Now again, when we see a case of ulcerative colitis, we need to understand that whether this case is a mild case or is a moderate category case or is a severe, or there is something called as fulminant ulcerative colitis. So we need to understand the stage of the disease. Now just to brief up, milder forms have symptom presentation where the patient has stools less than 4 times a day. Patients can have blood and may not also have no blood. There are no systemic symptoms. ESR usually remains normal and there are milder forms of abdominal pain. Patient may not have rectal pain, but tenesmus is usually present. So these are the symptoms. If we see the moderate kind of pains, patients usually have more than 4 times passing of stool, and generally the patient also will pass blood, so they will come with anemia. Abdominal pain again will be moderate. Patient may have off and on low rise fever, but signs of toxicity are not there. Coming to the severe form of ulcerative colitis, patient will pass more than 6 stools every day, and generally we can get signs of toxicity. Fever will be there, tachycardia will be there, patient will be anemic, and ESR will be raised. So these are the signs and symptoms. Now what is fulminant? Fulminant ulcerative colitis patients come with more than 10 stools per day, and blood will always be present. Abdomen will be very tender, distended, and patient may even require blood transfusion. Colon is dilated and the colon motility is reduced. Patient can come with toxic megacolon and can even have perforation. So this sort of a presentation is dangerous and can even lead to death of the patient. Now we need to understand what are the investigations that we can go for. Of course, we can go for CBC, ESR, and we can understand the severity of the case. Endoscopy, when done, will show confluent superficial ulceration and loss of mucosa. So this is a kind of report that you may see. Now, ulcerative colitis has a varied kind of presentation, and when understanding the diagnosis and deciding it, we must also consider other differential diagnoses such as Crohn's disease, very similar to ulcerative colitis, but there are many differences. Infective colitis, which is seen in cases of Clostridium infection. We can also have something similar in case of ischemic colitis or radiation colitis after radiative therapies, and then any poisoning or chemical colitis. Now, Crohn's disease and ulcerative colitis are two conditions which are very similar, but for the students, I'm just going to quickly take you through some important differences between Crohn's disease and ulcerative colitis. Now, Crohn's disease, the part of intestine affected is generally terminal ileum. That is the location which is not there in ulcerative colitis. When it comes to colon, it is also involved, but in ulcerative colitis, that is the actually part which is involved. Now, rectum is not involved in Crohn's disease, but it can be involved in ulcerative colitis. Perianal symptoms are always present in Crohn's disease, but they are not present that much in ulcerative colitis. Bile duct is not involved in Crohn's disease, but it can be involved in ulcerative colitis. Now, the kind of inflammation that we see in Crohn's disease is actually patchy kind of inflammation. But in ulcerative colitis, it can be a continuous inflammation throughout the entire part of colon. The depth of inflammation is transmural. When we see the layers, here it is just the mucosal part. On endoscopy, here I told you that there are continuous ulcerations in ulcerative colitis. In Crohn's disease, the pattern is snake-like ulceration. Snake-like ulcers are seen. Now, fistula is something that we see in Crohn's disease, but not in ulcerative colitis. Now, if we advise a patient to go ahead with biopsy, the report of biopsy in case of Crohn's disease will show granulomatous sort of lesions. Here we can see on the reports crypts and abscesses which are seen. Now, surgery as a treatment option is generally not seen to be successful in case of Crohn's disease, but in ulcerative colitis, it can really help the patient to improve the quality of life. The habit of smoking produces a high risk in case of Crohn's disease, whereas this is not really a predominant risk factor in case of ulcerative colitis. As compared to the malignancy, the chances of cancer is very low in Crohn's disease, but in ulcerative colitis it is high. So we must be very, very careful when we take such cases. Now again, investigations, blood investigations, since the patient is losing blood through stool, which is melena, patient can have anemia, patient's platelets will be raised. We can of course advise patient to go for electrolyte studies, where potassium will generally be low and magnesium will be low, so we need to give supplements to the case. If we advise LFT, we can see effects on bile duct. We can go for X-ray, we can advise patient urine analysis, and of course stool culture generally done. ESR will be raised, and CRP, which will show the extent of inflammation. Now, as I told you that this ulcerative colitis is an intermittent kind of disease where patients sometimes have flare-ups and sometimes will have no such episodes. In about 15% of the case, this disease keeps progressing. Okay, but 20% of the cases will go in remission. And sometimes patient can have more than 10 years of suffering with ulcerative colitis, so there is a high risk of cancer in these cases. So sometimes random biopsies are sort of done, and 5% of such cases can end up with cholangitis, primary sclerosing cholangitis, again a dangerous condition. Now, besides the the list of treatment things, it's very important to make dietary modification. The patient has to have rich fiber diet. Patient is advised to consume fish oil, or oatmeal is seen to have positive effects. If the patient is having constipation, on the contrary, enema can be given, and probiotics must be consumed as advised by the physician. Now, there are many medicines in homeopathy which, again, whenever given on the basis of the symptoms and the totality of the case and what the case needs, they have excellent results. So I'm going to quickly give you a long list. There are many medicines, but I'll still give you a list of medicines that your physician might advise. Starting with argentum nitricum, arsenic album, baptisia, calcarea carb, carboveg, colocynth, natrum phos, nitric acid, salicylic acid, Sinapis nigra, uranium nitricum, cuprum ars, Kali bichromicum, Merck sol, Merck cor, Lycopodium, Leptandra, Plumbum met, terebinth, phosphorus, and last but not the least, sulfur. Actually, there are many more remedies, but again, a small list of remedies that work and have wonderful effects on cases of ulcerative colitis, along with dietary modifications. I hope this video has provided good enough information. Go and study the details and go further and understand each remedy. Thank you very much for watching. Please do subscribe my channel if you like it. Give your comments, and if you like, please press the bell button. Thank you very much.